Doc on the Run. We help injured runners run.
3 things your doctor doesn't know about your stress fracture and may not be telling you. You know, metatarsal stress fractures are one of the most common injuries that afflict runners. And the problem with metatarsal stress fractures is there's actually a whole range of trouble. There's, the initial one where it's just kind of like an irritated bone, basically with a little swelling inside the bone. And then there are the ones where you actually run to the point that it completely breaks. Now, obviously, you can't run on a broken foot. You can't completely break the bone, keep running on it, and expect it to heal. So, you have to get straight answers from your doctor when you go and you've been diagnosed with a metatarsal stress fracture. So I wanted to try to explain today that there are really 3 things that I think doctors often don't really know about what's going on with your metatarsal stress fracture, but they don't tell you that they don't know it. And these are important things to understand because you want to make sure that you get the full story. After all, that's why you go to the doctor. You need an expert who's going to tell you exactly what's wrong with you, how bad it is, what you really can't do if you're going to get the thing to heal. So the first thing is whether or not it's actually a true stress fracture or a stress reaction. All right, so here's the deal. When you get a metatarsal stress fracture, it can be one of several different things. If you go and you run a marathon, you get an MRI, you're probably going to have at least one bone that the radiologist reads as a stress fracture, and all the radiologist really sees on your MRI is some increased swelling within the bone. Now, in those situations, nothing at all is going to show up on an x-ray, and even if you got a CT scan, which is like really a fancy series of x-rays that look in a lot more detail, you're not going to see an actual crack in the bone. So it's not like a true stress fracture. A fracture implies that it's broken, that there's a crack or a defect in the bone that you can actually see. So I think most runners don't actually have stress fractures. They actually have stress reactions. And I think that the term stress fracture is way overused, and most runners are overdiagnosed, I think, with metatarsal stress fractures when it's really a stress reaction. There's a big difference in those 2 things. One of them is just irritated and can calm down very, very quickly, and then you could keep running. But your doctor often doesn't know this. So they hear your story sounds consistent with a metatarsal stress fracture, and they tell you, okay, you have a stress fracture. It takes 4 to 6 weeks to heal. Here's your fracture walking boot. Use that for 4 to 6 weeks, and you'll be better. Now, the fact is that if you have a metatarsal stress fracture, a stress reaction, a stress response, whatever you want to call it, and it's anywhere along that continuum of trouble, and it's just really irritated all the way up to the point where it has a small crack in the bone, if you wear a fracture walking boot for 6 weeks, it will probably heal. Now, that doesn't mean that you need to wear it for 6 weeks. And the problem is that with you as a runner, there is a cost to being immobilized in a fracture walking boot for a long period of time. So you want to avoid that whenever possible. So that's the first thing, is to try to pin down your doctor and say, how can you tell? What can you do exactly? Because there are ways to tell, and you don't have to have an MRI necessarily to tell the difference between those things. In fact, sometimes an MRI will not clarify that for you at all, and it'll just mislead your doctor further. Now, the second thing, a big question is, is there anything that you could do to decrease the stress to that particular bone and keep running? Now, the fact is that most of the time you can. Remember, you don't have to just stop running to heal a stress fracture. What you have to do, though, is reduce the stress to the bone that got the stress fracture. So if you can reduce the stress to that one particular bone enough so that it continue to heal, then you're going to move in the right direction and you can keep healing. Because that's the deal, is you basically have to take off enough pressure from that bone that it's going to heal. There are lots of ways to do that. Bed rest is one way. It's not the thing most runners would pick, but that will work. A cast and crutches, well, that'll also work, but it's probably overkill. So that's the second thing. You need to figure out, and ask your doctor specifically, is there anything you could do or that I could do to decrease the stress on that particular bone and maintain my running fitness? That's crucial. And many times the doctors don't know that unless you really push them and try to get them to figure that out. The third thing is, can you do any other stuff to increase the rate of healing? Because look, here's the deal. You can think of your threshold for injury as like this line on a continuum. Where if you have bed rest down here and you have running an ultra marathon somewhere up here, then basically somewhere in between those 2 extremes, where one you're definitely going to heal and the other one you're not going to heal, well, somewhere in between is your threshold for healing. So you really have 2 choices. You can move that line in either direction. If you do enough of the wrong stuff, the line keeps going up and you're getting further and further away from healing. But if you do enough of the right stuff, that line keeps coming down, that threshold for healing keeps coming down. So you can do some things to speed up your healing. there are lots of things you can do, and your doctor almost never talks about this. They always want to try to do something really simple, like one thing, like put you in a fracture walking boot or tell you to stop running. But there's a whole range of stuff you can do. You can take nutritional supplements, you can use a bone stimulator, you can sleep more, you can remove environmental stressors. There are lots of other ways to remove stress and affect your rate of healing. So, the big thing is that you've got to talk to your doctor about that, because your doctors don't really bring that stuff up most of the time. It's unusual when somebody who's a runner goes to the doctor, they have a stress fracture, and the doctor says, okay, let's talk about your diet, let's talk about how much you sleep, let's talk about how much stress you have, let's talk about all these other strategies that can supplement the healing so that you can reduce your threshold for healing, and then you can do more to get above that line. So if you can do some stuff to decrease the threshold for healing, you can remove some stress, you can try to do some things that'll actually physiologically help you heal faster, then theoretically you should be able to keep running and still heal the metatarsal stress fracture. And if nothing else, you're going to decrease the amount of time that it takes to actually heal the metatarsal stress fracture so you can keep running. Those are really the things to talk about and think about when you go to the doctor, because I talk to patients all the time who call me and they really don't understand why they just have to stop running. They don't really understand why they have to wear a fracture walking boot. But these questions and getting your doctor pinned down on answers, they'll help you understand what you really need to do to keep running.
Doc on the Run. We help injured runners run.